On this occasion, we have a 60-year-old gentleman who has had a surgery in an outside hospital, following which he had developed a pulmonary thromboembolism, which is essentially a clot in his right side of the heart and which is extending in the lungs. So, which is a life-threatening condition for which he was taken up for surgery, that is emergency surgical pulmonary thromboembolectomy, which was done in Century hospitals. At that point of time, the patient's blood pressure was between 30 and 40 millimeters of mercury, which is not compatible with life. But the patient was put onto a crash bypass, and then subsequently the heart was exposed, and we have taken out a clot from the right side of the heart, which is the right atrium, right ventricle, and also from his major venous drainage system, that is the superior vena cava, inferior vena cava, and also extending into the pulmonary arteries. During this procedure, we had a novel procedure wherein the clots have been removed, and we had looked into the pulmonary arteries right down into the lobar arteries, confirmed that there was no further clots right down his pulmonary arteries. Post-procedure, the heart had recovered, and most of the candidates tend to have a right heart failure who go on to an ECMO. But on this occasion, we didn't need ECMO support because the patients had good support inotropically in the intensive care unit, and he has made a significant recovery and has been discharged after 10 days from the hospital to 4 hours, during which the patient's blood pressure was, as I've said, was 30 to 40 millimeters of mercury. And you pretty well know when the blood pressure falls to 80, patients do feel dizzy. But somebody with 30, 40 is incompatible with life, but he has been taken on a crash bypass, which is heart-lung bypass machine, and we had extracted this clot.